Assalamu alaikum ma'am. My name is Muniba Abid and my roll number is BP1650155. My topic is antihypertensive drug which is Enalapril. First we talk about Enalapril, which is a medicine to reduce high blood pressure or prevent or treat the heart failure. If you have a blood pressure or Enalapril will reduce or prevent future heart stroke or heart attacks like that. Enalapril is also available mixed with another blood pressure medicines called hydrochlorothiazide. Now, if we talk about key effects of enalapril is lower your blood pressure. It makes easier for your heart to pump blood around all over your body. Your first dose of enalapril may make you feel dizzy, so it is best to take it at the bedtime, but after that you don't feel dizzy. You can take it at any time of the day. Some people get irritant cough which because of enalapril. If you get severe diarrhea or vomiting with the stomach bug or illness, tell your doctor. You may need to stop taking enalapril for a while, but you feel better after that. Drinking alcohol also make you feel dizzy or light-headed with enalapril. Make sure that enalapril is mainly high drug which is used in hypertensive drug. Now, if we have a look the indications of enalapril, it is an antihypertensive drug, as you know, and it also used in chronic heart failures. Now we talk about the main side effects of enalapril, which is breathing problem, and the symptoms are included in trouble breathing or swelling, liver problems, in which symptoms are yellowish of your skin color or whitish of your eyes, central nervous system problems like lightheadedness and etc. Also we have kidney problems, angioedema, all that. Now if we talk about the dose adjustment in pediatric, we talk 1 month to 17 years, dose should be 0.08 mg per kg of body up to 5 mg once per day, and maximum dose is 0.58 mg per kg taken by mouth once per day, 40 mg once per day. And after that, if we talk about in adults 18 years and older, it's the usual dose range is 10 to 40 mg per day. The maximum dose is 40 mg per day. In pregnancy, 10 mg dose during pregnancy. Now come to the next point. If we talk about the drug brand names, which is Ranetec, Zapris, Redopril, they all are the brand names of enalapril or antihypertensive drugs. If we talk about the drug interaction, a few items that may associated with the medicines include aliskiren, certain medication that diabetes invulnerable framework, and the other potassium degree of potassium in blood, for example ARBCs, including losartan, valsartan, contraceptive pills containing a lot of sacubitrils. Now come to the next point, which is drug toxicity with mechanism. There is a limited data about enalapril overdose in humans. Overdose may result marked hypotension and stupor. It is an ACE inhibitor, not only failed to ameliorate nephrotoxicity induced by CP, both in male and female genders, but also aggravates is nephrotoxicity in the female gender pressure. Now, irrational use of enalapril drug. It is possible that enalapril are overprescribed in patients with single ventricle physiology that can lead to various problems. Suboptimal dose of enalapril in hypertension can lead to the hypertension related problems. Now, if we talk about the pupils who can or cannot take the enalapril, like the adults, if you talk about adults and children both, if you have diabetes, check your blood sugar level like glucose more often, particularly in the first few weeks. It is because of enalapril can lower the dose of sugar level in your blood. Enalapril is not suitable for everyone, so it is very necessary to make sure that it is safe for you, and tell your doctor or other health professionals if you have an allergic reactions to enalapril or any other medicine in the past. And next is, and trying to, if you are trying to get pregnant and already pregnant, or you are breastfeeding, it is not good for this type of women. The next point is, if we are having dialysis or any other type of blood filtration. The other point is, if you have heart, liver or kidney problems, unstable or low blood pressure, have diabetes, and if you have recently diarrhea or vomiting or low salt diet, all these types of patient needs to first talk their doctor, then do this. Now we come to the case study, which is, we have a patient, her name is Lucy. She is 47 years old lady who presented her essential history care supplier with a main objection that her BP was estimated at a representative well-being screening a month ago, and she was told that she has stage 1 hypertension. Around then, her supplier has never revealed to her that she has hypertension. She has been encouraged in any cases to misfortune weight and exercise more. Her BP was 143 and 185 mmHg to 146 to 87 mmHg. When estimated a year ago, busy working during a worker well-being screening. Lucy smokes one packet each day of cigarettes and thinks that her BP may be high a result of occupation-related pressure. She does not accept that she truly has hypertension. Lucy does not connect any standard type of activity and does not confine her eating routine in any capacity, in spite of the fact that she realizes she is out to get more fit. Now, if we talk about patient physiology, patient's weight is 108 kg. She is 175 centimeter tall. Her BP is 143 to 85 mmHg with left arm and 146 to 87 mg on right arm. While sitting, heart rate is 8 beats per minute and regular. Now, if we talk about the subjective, in which we have chief complaints like she has hypertension stage 1, onset of symptoms is 1 month ago, smoking status is 1 cigarette per day, 1 cigarette pack per day, gender female, age 47 years old. Now, subjective physical examination, patient is 1 centimeter tall, 175 centimeter tall, weight is 108 kg, body mass index is 35.2 kg per mass. Vital signs are BP is 143 to 85 mmHg left arm and 146 to 87 mmHg right arm, while sitting heart rate is 80 beats per minute and regular. The assessment is due to this continuous elevation in blood pressure indicates that patient has hypertension 1 type 1. Now if we talk about plan in which we have medication therapy, it is based on patient's condition. She needs to be on Enalapril initially 2.5 to 5 mg per day and maintain the dose with 10 to 40 mg per day. Now if we see the care plan, the lifestyle modification, like she needs to exercise and walk to reduce the body weight, proper diet which is rich in fruit, vegetables, whole grains, low fats, poultry and fishes. Low dietary salt intake. She should avoid the red meat, fats and alcohol. Suggest the patient routinely to monitor the blood pressure. Now the outcome of the patient, we needs to talk like the patient showed the good compliance with therapy, monitor and trifork usage, showed reduction in BP. Patient was suggested to visit its physician if any unusual symptoms occurs. Now, if we talk after that, if we talk about the drug doses or something side effects like that, so maybe the serious side effects of the drug also occurs, which is allergic reactions, or we should go straight to the doctor first after taking the medications. Now there is my presentation is done. Thank you so much.